The Government Accountability Office examines healthcare spending. A key healthcare leader relinquishes his gavel. And the President signs the One Big Beautiful Bill Act into law. For the week of July 7th, 2025. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
And it includes the largest tax cut in American history, the largest spending cut, $1.7 trillion, and yet you won't even notice it. Just waste, fraud, and abuse in American history. So you have the biggest tax cut, the biggest spending cut, the largest border security investment in American history.
Kicking off this week's episode with news from the White House, where President Donald Trump signed the budget reconciliation package known as the One Big Beautiful Bill Act into law on Friday, during a military family picnic at the White House for the 4th of July. The ceremony marked a significant victory for congressional Republicans and the Trump administration in finalizing the $3.4 trillion tax and spending package containing the president's domestic policy agenda. The Senate passed the bill on Tuesday after a marathon voting session known as a vote-a-rama, during which Democrats attempted to put Republicans on the record through amendments to the package, many of which related to cuts to social safety net programs. The final Senate vote was 51-50, with Vice President J.D. Vance breaking a tie, and Republican Senators Susan Collins of Maine, Rand Paul of Kentucky, and Tom Tillis of North Carolina joining Democrats in opposition to the legislation. The House of Representatives followed suit, passing the motion to concur in the Senate amendment to H.R. 1 on Thursday, after nearly 24 hours of deliberation in a 218-214 final vote. Republican Representatives Brian Fitzpatrick of Pennsylvania and Thomas Massie of Kentucky joined Democrats in opposition to the bill. Prior to the final vote, House Minority Leader Hakeem Jeffries, a Democrat from New York, delivered a record-breaking 9-hour floor speech attacking the package. House Republican leadership successfully overcame inter-party discord related to the changes made by the Senate to the bill. Concerns from moderate Republicans related to deeper cuts to the Medicaid program, while fiscal hawks objected to additional tax cuts added by the upper chamber. The president and Republican leadership made assurances to GOP holdouts behind closed doors, but did not entertain changes to the bill text. Had the House made any further revisions to the package, the Senate would have been forced to vote again, delaying passage of the measure and potentially risking Republicans' self-imposed Independence Day deadline. The final bill text includes a one-year Medicare physician payment fix to increase provider reimbursements by 2.5% in 2026. It establishes new Medicaid work requirements and would phase in a 3.5% limit on provider taxes in Medicaid expansion states. The new law also includes a $50 billion fund to support rural hospitals in response to concerns about the impact of the bill's Medicaid cuts, which total approximately $1 trillion, on financially vulnerable hospitals. The Budget Reconciliation Bill will also expand the orphan drug exemption under the Medicare Drug Price Negotiation Program.
All the things that I used to say, all the words that got in the way, all the things that I used to know have gone out the window. All the things that she used to bring, all the songs that she
2023, our nation spent an estimated $4.9 trillion on health care. That's nearly 20% of our gross domestic product. And when it comes to per-person health care spending, the United States far surpasses every other nation in the world. And yet, America's health outcomes still lag behind our peers. Life expectancy.
Shifting to news from Congress today, where Representative Buddy Carter, a Republican pharmacist from Georgia, announced last week that he's stepping down as chairman of the House Energy and Commerce Subcommittee on Health. Carter, who launched a campaign for the Senate earlier this year, stated that he will continue to be an active member of the subcommittee and work to advance the president's Make America Healthy Again agenda. Shortly following Carter's announcement, Committee Chairman Brett Guthrie, a Republican from Kentucky, appointed Representative Morgan Griffith of Virginia as the new Health Subcommittee chairman. The full extent of the resulting subcommittee leadership and member subcommittee assignment changes can be found at the committee's website at energycommerce.house.gov. More from Congress today, where Representative Dwight Evans, a Democrat from Pennsylvania, has announced his plans to retire at the end of the 119th Congress. Evans is a member of the House Ways and Means Committee and has served in the House of Representatives since 2016. Representative Don Bacon, a Republican from Nebraska, also officially announced his decision to not seek re-election in 2026. He was first elected to the House in 2016. Bacon, who has a reputation as a centrist, cited the current, quote, political dysfunction as a result behind his decision to retire. The Government Accountability Office, or GAO, has published a report on its October 2024 forum on U.S. healthcare spending. During the forum, participants identified approaches in the following 5 areas that could help reduce healthcare spending or increase the value for that spending. 1. Supporting a high-functioning primary care system. 2. Expanding the healthcare workforce. 3. Reforming healthcare pricing and promoting high-value care. 4. Reforming Medicare physician payments. And 5. Mitigating anti-competitive incentives and practices. Participants agreed that legislative action, federal investment, or both, would be needed to implement most of the approaches discussed. Final news today, where on July 1st, U.S. District Judge Melissa Dubose of the District Court of Rhode Island issued a preliminary injunction against the Department of Health and Human Services in response to mass staff cuts at the agency. The plaintiffs, a group of 19 state attorneys general, had originally argued that the layoffs by HHS Secretary Robert F. Kennedy Jr. had been an overstep of constitutional authority. They further claimed that the HHS restructuring and dismantling of several sub-agencies, including the National Institute for Occupational Safety and Health and Center for Tobacco Products, had effectively eliminated public health programs on which their states rely. In issuing the preliminary injunction, the court found that the Secretary's actions were arbitrary and capricious under the Administrative Procedures Act. The cuts and reorganizations of HHS would cause irreparable harm to the states if allowed to continue, and the plaintiffs were likely to succeed in proving their case on the merits. The federal government is therefore barred from further executing any existing reduction in force notices or sub-agency restructuring, and cannot issue any more termination or administrative leave notices until the case has been fully decided on the merits. HHS has requested that the injunction be paused, pending an appeal. We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Tuesday, July 8th at 10:15 a.m., the House Veterans Affairs Subcommittee on Health hosts a markup of multiple health-related bills. Second, on Wednesday, July 9th at 9:45 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, convenes an executive session to consider the nomination of Susan Maneres to be the director of the Centers for Disease Control and Prevention. Third, on Tuesday, July 9th at 10 a.m., the Senate Help Committee holds the hearing Securing the Future of Healthcare, Enhancing Cybersecurity and Protecting Americans' Privacy. Fourth, on Wednesday, July 9th at 10 a.m., the Senate Appropriations Committee gavels in the hearing titled A Future Without Type 1 Diabetes, Accelerating Breakthroughs and Creating Hope. Fifth, on Wednesday, July 9th at 10:15 a.m., the House Energy and Commerce Subcommittee on Health holds the hearing Legislative Proposals to Maintain and Improve the Public Health Workforce, Rural Health, and Over-the-Counter Medicines. Sixth, on Thursday, July 10th at 9:30 a.m., the Senate Appropriations Committee hosts a markup of the Commerce, Justice, Science, Agriculture, Rural Development, FDA, and Legislative Branch Appropriations bills. Seventh, on Monday, July 21st at 5 p.m., the House Appropriations Subcommittee on Labor, Health and Human Services, Education, and Related Agencies hosts a markup of their fiscal year 2026 legislation. And last, on Thursday, July 24th at 10 a.m., the full House Appropriations Committee convenes a markup of fiscal year 2026 Labor, Health and Human Services, Education, and Related Agencies legislation. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.